And welcome to Mental Health Matters. My name is Jason Mann. I'm with Lisa Ann Butcher, and Lisa is a registered clinical counselor and the founder and director of Three Sisters Counseling, Inc. You're with the BC Association of Clinical Counselors. I guess that's the accreditation, correct?
That is, yes.
Yeah. And as part of that, you specialize in treating first responders and trauma that they experience on the job.
I do. I came to that actually quite uniquely, or maybe let's say organically in certain ways. I used to be, prior to being a mental health counselor, I was a first responder. I was a respiratory therapist in the healthcare system in both Ontario and BC for 18 years. And so it became a natural sort of niche, I guess, that I determined sort of partway through my training, where I would see people who were first responders and they would say at the end of the session for the first time, I didn't have to explain what I was talking about and they could just freely speak. And there's a lot of jargon that goes along with first responders, whether you're RCMP or BCEHS or otherwise, to be honest, even someone working in healthcare as a nurse or RT or doctor. There's a lot of jargon that goes along with that. Then they can just kind of freely speak about everything that happened. And that's kind of how that came organically to me, treating that population.
Yeah. So you, in your role then, as in the hospital system, what experience or what was the reason for transferring into more of the mental health side of things? I guess let's start there.
I was going to say, don't ask me a B question because I always forget the A if someone does that. How that started actually was I was an RT working for probably about 10 years, I would say. And I really liked initially what I liked about being an RT. And it sounds terrible, but I wasn't much of I don't know. I didn't really like getting involved in kind of the social aspect of things. And I was a social person, but I didn't really want to kind of talk to people about, what was going on for them. I just liked being an RT because you would kind of, fix the problem and then leave. And interestingly, about 10 years in, and I don't know if this was a shift in my personality or maybe just getting older, I started to really dwell and be interested in how someone's physical health was actually impacting their mental health, how, let's say, that child being sick was affecting everyone else in the family. And I found myself kind of to the annoyance of some of my coworkers talking to families for like 40 minutes when I could have kind of been moving on to something else. And so people would say like, okay, Lisa, yeah, let's go. And so what I decided to do was go back to school and I did my master's in counseling psychology and I became a registered clinical counselor with the BC Association of Clinical Counselors and then started my own practice, which then translated into really a first responder niche, which has been very helpful, I have to say, in both Vancouver and Kelowna because I work in both.
And I imagine, obviously not to take away from anybody's experiences, but like a first responder is front line and center for some pretty, terrible stuff, right?
It is. And I think there's something, I don't want to use the word interesting because it's sad really, but what happens to us as first responders, and I can say us because I was one for many years, is it becomes normal. And you kind of wonder, at what point did this become normal that I can see this stuff and I don't think anything of it?
Right.
And then there are certain things, and if you ask any first responder, it doesn't matter what type of first responder, whether it's in healthcare or as in the RCMP or otherwise, you ask anyone about certain cases or certain things they've been to, and generally we can talk about a lot of things, but there's sort of 5 that jump out to all of us where it'll still make us cry. It'll make you shake if you're talking about it. It's really impactful. And those are the things that I think we kind of carry with us that I think is really important to kind of process and talk to someone about.
So maybe we could dive into that a little bit more. Like, what about some of the traumas that first responders might actually experience?
Yeah, the first thing I always tell people is it's cumulative, right? And people don't realize how cumulative the trauma is. So if you think about it, the interesting fact actually is that in a regular person's life, so just not somebody who's in any type of first responder role, it's actually only normal to see or hear about one trauma in the whole course of your life. Wow. And what's crazy is the best word to describe. What's crazy about working as a first responder is sometimes in one shift, you can have multiple things happen. And we would go from call to call to call. And I mean, I talk to medics all the time who will, to go to a PEDS call or go to a cardiac arrest or whatever, and in succession, and then they just go home, and I mean, this is the same for RCMP. It's trauma after trauma. I talk to physicians as well who go from one trauma room to the next trauma room or one ICU room to the next ICU room, and it's never really debriefed. And at some point it became, quote, normal to us. But I talk to people a lot, and I do a lot of mental health talks. It's part of my business, is going around to different institutions and talking specifically to hospitals and RCMP as well, as medics, where I talk about the cumulative effect of that trauma and has it changed you as a person? And the answer is yes. There's actually really no way that it hasn't changed you as a person. And I think that's something that people don't realize.
I agree. And in fact, I think that a lot of people just sort of say, well, they're police, they must be built in a certain way that they can cope with it and manage with it. And thank goodness for them. But not thinking too much past that. So you're saying that is like something that people, just because you're people, you're going to carry it. It's going to, cumulatively impact you. But so what are the percentages, or how, because I sense and again, I'm not in the realm, but I get the sense that maybe counseling isn't something that a lot of first responders have on their to-do list.
They don't, and that's something that I think is shifting now. They're really pushing it, specifically actually in the BC Emergency Health Service. They're really pushing it also in the RCMP. That's, I hate to say it, but a new thing that has come in the past few years, as well as with physicians as well. Interestingly, I see a lot of medical residents who are in their training, and they are just kind of getting benefits to having counseling, which is like as in health benefits. So that's a new thing that's shifting, and I think that's a really good push, because we need to recognize the cumulative effect of that trauma. I also think, we need to look at kind of how this has affected us, and that we are actually just human. Like you just said, sort of, we think RCMP officers are built differently. They must be built differently. They're actually not. They're humans. Yeah. And so what's interesting about it is that you will meet people in certain jobs, and RCMP is a perfect example, actually, because I see a lot of RCMP officers. There's a hardness to some of them, many of them actually. There's a disconnect and a hardness. And where does that come from? Were they disconnected or hard at the beginning of their job? Not necessarily. And there's also a protective factor, and I know this in healthcare as well. It's the trauma actually occurs from the details. So people will often think, if you're not in healthcare, for example, it must be, the person that came in from that big car accident and you saw them hurt from their car accident on a stretcher. That must be the trauma. Yes, that's traumatic to see, but that's not generally what bothers people. What bothers people is the family then coming in, hearing the mom scream, hearing what the dad's saying, hearing the sister say, well, we were supposed to go to Disneyland. Are we still going to Disneyland? Like, that's the trauma that comes in, and people will sort of overlook that. And if you work in those situations, it's actually the sights and sounds that are the most traumatic. And I have a friend who's an anesthesiologist who used to be a paramedic, and he has said actually the most traumatic things he ever saw was outside of being a doctor. Actually, it was working on the front line as a medic, because you go into people's houses, you can smell things, you see things, you see pictures on the wall, and once they get to the hospital, it's controlled. I mean, compared to on scene somewhere.
Yeah. Not to get too personal, but my mom's brother was an RCMP officer, and I would have been about 5 years old when he died of cirrhosis of the liver. And that was obviously brought on because he was trying to cope and manage with the pain of scraping bodies off the highway and everything else that was terrible happening.
And you mentioned that, and if I can interject about that, so there is actually a huge culture of drinking amongst paramedics, healthcare workers, and RCMP. That's not to say every single one drinks, but there is actually a culture that is hidden. And I bring it to the surface a lot specifically I bring it to the surface when I'm speaking with RCMP officers or healthcare workers or otherwise, because it's somehow normalized. And sometimes it's, oh my gosh, what a crazy shift. You want to go out for some beers? Other times there are actually people I've spoken to who come off shift at the hospital. They'll go home and have a drink before they go to bed. And it's only one, but it turns into two. And honestly, it's 7 o'clock in the morning, and there are people listening to this right now who will be massively shocked by that. And then there are people who work in it who will be like, yep, you know, and it's just a fact. So, I mean, I think alcoholism and substance use is something that goes, and we just did an episode on this, you and I talking about chronic pain. You know, we talked about that, substance use with chronic pain, and that there is also emotional pain. It's not just physical pain that we try and disconnect from.
Mm-hmm. And you say it changes, it can change you as a human. Can you describe that?
Absolutely. So, I mean, I have 3 kids, and interestingly, if you ask them, they constantly send me these memes. It's sort of a joke, which is really fun. It's funny and sad in certain ways. I am the kind of parent, and I've always been this way, where, so say a bunch of kids are playing at the top of the stairs, and I'm with a bunch of moms who are not in healthcare. And all the other moms are like, careful guys at the top of the stairs, you don't want to fall backwards and break your arm. And I'm like, careful guys, you don't want to fall backwards and break your neck and never walk again and be a high quad and you won't, you know, and I go on down this spiral because to me, I'm not worried about them breaking their arm. I'm worried about the worst things that I've seen. And what I've seen as a healthcare worker, again, there's sort of those top 5 things that I've seen that still resonate with me and have actually changed me as a parent. And so, you know.
Catastrophizing?
Yep, catastrophizing. And I'll give you an example of that actually. So probably 20 years ago, I was training as a respiratory therapist, and this was in Toronto. And I met a kid who was 17 years old who, when he was 1, he was in a like superstore, like a supermarket with his mom, and he was sitting in the front of the cart, and his mom, like every other mom, just kind of rolled down the center of the aisle and was trying to get lettuce or whatever she was trying to get, and over here the kid grabbed a grape and popped it in his mouth and had a full airway occlusion, and he was what we call down, meaning he has no heart rate or respirations for an extended period of time. He was resuscitated, but unfortunately when he was resuscitated, it's too long. He was down for too long. So he has lived for 17 years, but unable to communicate on a ventilator, and this has been him. And I say this openly to people because people don't realize, and so how that changed me as a parent is I had 3 kids. I never, every time I walked into Superstore or otherwise, I was in the dead center of the aisle, or I would push my kids past the aisle. And that is trauma, because it really affected me to the point where it changed the way I parented. And I mean, you know, people who know me will always make jokes. I mean, I probably quartered grapes for my kids till they're about 12. Like, it's just, it is. Yeah. I mean, and we kind of laugh about it, but that is how it affects you, you know? And I think every RCMP officer has a thought like that about something that's dangerous that I might not even think about, but they've seen a million times. Every paramedic has that, and every healthcare worker has that.
Wow. And that list would just kind of grow.
It grows over time. And if
to the point where you're kind of not even able to potentially like function properly.
Exactly. And I often use this theory, it's called a backpack analogy, but if we think about our trauma, what I like to say is all of us are wearing a backpack, and we're walking around with a backpack every single day, right? So you have yours on, I have mine on, and what's inside of our backpack is every single thing that we haven't really processed, every single thing that has affected who we are as a person or what we believe about ourselves or the world or other people. And so these traumas get plopped inside our backpack. So if you think about it, if you are working as an RCMP officer or anyone in healthcare, you've probably got, let's say 60 pounds maybe even in your backpack. So things seem heavier, things seem harder.
But it's like a frog probably being boiled, right? It's cumulative over time. You might not notice the first one too much, the second one, but if you were to put it all on you at once, you'd be like, oh, this is unsustainable, and maybe do something about it. But over time, it's slow and insidious and creeps up on you. Would that be fair?
That's exactly true. And I often see people through insurance claims. So whether it's through Medivie, if you're with the RCMP, or it's through the BCEHS or CIS, and we are providers for both. And Physician Health Program is another example. I often see people, so for funded counseling, and that's one of the things we talk about is the backpack analogy. And interestingly, these are people who are off work because they're unable to work now because of their cumulative trauma. But they think, well, why can't I get back to work? Like, I feel like I've processed that one event. It's not the one event that made you go off, because it's one traumatic event. They'll say, I can't do this anymore and I have to be off. But it's actually all the other traumas that prevent them from going back. Because yes, we can process that one thing, but we actually have to go back and process all those other things. And you sometimes hit it where they'll say, well, I've seen so many things. And I say, so tell me about some of them. Some of them they just blow through and they just tell me, and that's why it's helpful that I was in that, because I follow what they're saying without them having to say, and then we gave epinephrine. Epinephrine is blah blah blah. They don't have to explain that. But what ends up happening is they hit one, and then they'll start to shake or they'll start to cry, and they're like, geez, I don't know where that came from. I haven't thought about that in 15 years.
Wow.
Yeah.
Wow. So fascinating.
Yeah.
So for the first responder, or maybe even the first responders' loved ones, what are some of the signs or things that you kind of need to pay attention to that would say, I need to deal with something here?
I'm glad you said first responders' loved ones, because that's another thing. I mean, I see a lot of people who are in relationships with first responders, and that it trickles down. Everyone is affected, and anyone who is the spouse of a first responder of any type is totally hearing and feeling what I'm saying right now. It does. It affects everyone. It affects kids. And so I think something to think about is, accessing that help. So signs and symptoms that you might notice would be disconnect. They have no bandwidth for anything at the end of the day. They're withdrawn. They want to just kind of, shut their phone off. And there's, to a certain extent, that's fine, but when it becomes, I don't want to go to that thing. I don't, I'm just going to go to sleep right after my shift. Drinking, substance use, it's really important to process. And there are certain things that we use to process those. There's certain techniques, and we are going to be doing an episode about certain techniques for that. But an example of that would be EMDR therapy. People use somatic therapy, which is really just processing that physiological response, because there's the cognitive piece about what did I see and how do I feel about it, but there's also the physiological response, which is how is my body actually reacting to that. Like, people feel keyed up, and I always do this because they literally are walking around and they don't even know, their jaws clenched and they're, So
EMDR, somatic therapy. Do you want to talk a little bit about these therapies, or do you want to cover that in a separate?
No, I can briefly talk about it, and I encourage people to tune in to, we are doing a specific episode about EMDR and accelerated resolution therapy specifically for trauma. There's lots of different options that you can choose from, and people will sometimes contact us and say, I want to do EMDR. I do encourage people to remain open about that, because there might be something that works for you better, right? So I always encourage people to come in and say what's going on for them. But there's something called accelerated resolution therapy, and we're going to have our expert Suzanne Noel on to talk about that. That is amazing, and I mean, just very quick responses, like within 1, 2, 3 sessions. Wow. And it's specifically processing like one event, which is super interesting. I've some of the paramedics that I see, I have sent to Suzanne, and they've just been like, this is amazing. And you can do it concurrently with your current therapist too. Like, they'll still see me, but they also see Suzanne for a specific event. So those are really helpful. Generally, what we look at with EMDR specifically is the underlying narratives that are created and what we believe about ourselves. So if we look at traumatic experiences, when I talk about, let's go back to that kid I was talking about who choked on the grape, what did that change about me? What do I now believe? I believe that it is unsafe in a grocery store. Really, that's my underlying narrative, right? I believe that I need to do certain things in order to protect my child. And that has actually changed everything about the way I do things. And so there's an underlying narrative that could translate into, I'm not good enough, I'm about to fail, I can't protect myself or my kids. And there's underlying narratives we look at with EMDR. And sometimes you'll say things and it'll jump out to someone and they'll say, that's totally me. Yeah.
So what do you want first responders to know?
I'd like them to know that they're not alone. I mean, I feel like the first thing people say to me when they're first responders, when they come into my office or they see me online, is, oh my gosh, I'm so sorry I'm here. I know people have so many worse problems. I know I should be able to handle this. And why is that? Because the culture of RCMP officers, BCEHS, and this is not just in BC, this is paramedics everywhere. Any healthcare worker anywhere, whether you're a doctor, nurse, RT, or otherwise, LPN, I mean, it goes down the list, are sort of, I don't want to say we're trained, but we experience so much trauma on a day-to-day basis.
You develop a callus?
Yeah, like you kind of just develop like it's just part of the job, and you don't think to process it. And I think what I'd like for people to know is you are actually dealing with hard things that are not normal, regular things that people should see.
Yeah.
And so it's not something to just say, well, it's part of the job, I'll just continue on, because that actually does back up on not only you, but your family, your ability to continue with your job. I see no shortage of people who have to go off work after very short periods because of consecutive traumatic events. And I actually was hired a couple years ago to create the first terminal, what we call terminal extubation. So when we remove a breathing tube from someone, their RTs remove that breathing tube, and so we've essentially ended someone's life. It's at the request of the doctor and the family, but we are the ones who physically take that out. And so there's a terminal extubation protocol that I've developed now of 5 mental health questions that people can ask their staff, and one of the questions is, how long have you carried this with you? Sometimes people will say, I didn't even think about it when I left. And it's not to say they're disconnected and don't care, but it's just, it happens so often that sometimes it doesn't bother them. But then other people will say, I carried it for months afterwards. So it's a really good mental health check to just make sure that you're getting the access to care that you need. So I would say what my biggest message to all first responders would be to know, A, you're not alone, and B, there is actually help out there. And I encourage people to reach out.
Okay, so how can a first responder then, or a first responder's loved one, reach out to connect with you and to begin the process of getting some help?
So my company is called Three Sisters Counseling Incorporated, and we are located in Kelowna and in Vancouver. We are providers for Medavie and BCHS and a whole host of other direct bill through your insurance. So it's quite easy in that way. Our admin does all of that setup for you, so it's quite easy. All you have to do is reach out, and how you would do that is www.threesisterscounseling.com. That's the way to get a hold of us. And if you prefer non-internet, you can call us at 778-222-7778.
Awesome. Well, what an important topic. And I'm just glad to hear that there are changing conditions, financial support and encouragement for these folks to get some help. So thank you for sharing everything today.
Thanks so much too for having me today.
Indeed. And this has been Mental Health Matters. Thank you for watching.